Okay, the two questions that arises is why when we are taking a lot of calcium supplement and yet despite of that we are still having osteoporosis. And also those taking glucosamine, chondroitin and MSM, the joint pain goes off and it recurs back. Now the research goes on when we found Professor Michael Horlicks, who is a biochemist. He found that in our body there is actually a cholesterol called 7-dehydrocholesterol. Now when this cholesterol it occurs at the skin level and is converted into a provitamin D. And where is the presence of sunlight, especially the UVB, this provitamin B3 is been heated up to become a pre-vitamin D3. Now this goes directly to the liver. Vitamin D3 can also be taken in the form from the food or directly by taking vitamin D2 or D3 or supplement. The problem today is most people are not going out the sun or they're beginning using a lot of sunblock. So there's a lack of vitamin D from the sun. Now at the liver, there is an enzyme called 25-hydroxy vitamin D3 hydroxylase. This hydroxylase enzyme converts this vitamin D3 into still an inactive form of 25-hydroxy vitamin D3. It next goes to the kidney. Now at the kidney, there is another enzyme which is called a 1-alpha 25-hydroxy vitamin D3 dehydroxylase. This dehydroxylase enzyme converts this vitamin D3 into an active form called 1-alpha 25-hydroxyl vitamin D3, which later will be converted into a hormone called calcitonin. Now when our body lacks calcium, what happens is at the thyroid gland, it produces a hormone called thyroid stimulating hormone. The thyroid stimulating hormone will mobilize calcium about 95% from the bones and the teeth. And this hormone will continue to take out calcium unless it's inhibited by this hormone calcitonin. So calcitonin is an inhibition hormone that prevents the thyroid stimulating hormone from continuing mobilizing calcium. Now when this process can be represented in the form of a diagram. When thyroid stimulating hormone occurs, it produces a lot of the cells called osteoclasts. Osteoclasts will eat up the bone or takes up all the calcium from the bone. However, with the presence of calcium and calcitonin, it will produce another group of cells that is called osteoblasts. Osteoblasts rebuilds back the bone again until it restores back the bone at the rate of about 10% per year. So in other words, Professor Horlicks says the bone is actually a living organ. We can restore back our bone where there is enough calcium and the hormone calcitonin. So the definition of osteoporosis by Dr. Horlicks is that if our osteoclast is more than our osteoblast cells, then process of osteoporosis occur. And if our osteoclast is less than our osteoblast, then we can regain back our bone density. Now the second part of the calcium is actually the calcium absorption process. In a normal phenomenon, most calcium absorption in the body ranges in the form about 10 to 12%. Calcium are mainly absorbed in the body mostly to the last part of the small intestine and also a major part from the large intestine. The last part of a small intestine is the ileum, and the rest are the large intestine. Within this organ, it contains a lot of bacteria, or we call it probiotics. In the ileum, we have a lot of bifidobacillus. Well, in the large intestine, it contains a bacteria called lactobacillus. There are 23 species of lactobacillus. The bifidobacillus and the lactobacillus produces short-chain fatty acids such as pyruvic acid, butyric acid, and lactic acid. And they are very important in preventing colon cancer. Now, research has found that the existence of these bacteria and their proliferation has a lot to do with the absorption of calcium. So by feeding this bacteria with prebiotic, that is those fibers such as fructooligosaccharides and inulin, and also by giving them acacia gum and the necessary vitamins such as vitamin A, vitamin C, and zinc, this bacteria will proliferate and produces more of this short-chain fatty acid. As such, it reduces the pH of the small intestine and the large intestine and increases the absorption of the calcium to 40 to 48%. Now, the last part of it is about your joints inflammation. Now, when joint inflammation occurs, there's a tendency of patient or doctor resorting to giving them chondroitins, glucosamine, and MSM. These are very effective in curbing the inflammation. But after that, it recurs again. Now, we found out that research found out there are two aspects of it. That is, there's a lack of curbing the inflammation process. So by giving the enzyme blocking therapy, that is by giving the adequate and appropriate amino acid, and also by giving them the super antioxidant, this process of inflammation can be overcome. As such, by giving just glucosamine, chondroitin, and MSM is not adequate. There is a further need to add the necessary amino acid to stop the inflammation and also the antioxidant to stop free radicals from causing the inflammation. The Miracle has formulated a holistic D3 ionized calcium products that give you 5 benefits. The first benefit is that it restores your bone density. And the second benefit of this D3 ionized calcium is that it helps to produce the calcitonin hormone that will stop the mobilization of the calcium. And thirdly, it stops osteoporosis in the bone. And the fourth function, it increases the calcium absorption in the body. And fifthly, it stops joint inflammation. So D3 ionic calcium by The Miracle International is a holistic approach. So it answers why when we take calcium and yet we have osteoporosis. It's because the hormonal aspect of the product is not being taken care of, and also the reversal of the osteoporosis, the absorption of the calcium, and also the prevention of the occurring of the inflammation or arthritis in the body.